Hi, I'm Lauren Edmonds. I'm the founder and owner of a school that supports children with learning delays. I'm hoping this space gives you something to think about. Paying attention is such a complicated and nuanced subject, especially because it is couched in acronyms like ADHD and talk of medication. It's also often talked in the context of mainstream schools having only one solution for a child who's not paying attention, and that is medication. But I want to talk about some of the very smaller, intricate parts of attention that help us to understand what we're talking about, which helps us to understand what we're aiming for. I want you to consider 3 kids sitting around a desk, around a presentation area where a teacher is teaching them a concept. So there's only 3. It's not a class of 30, just 3 kids. And the teacher has brought their attention to it. So she said, we're going to do this very exciting thing. It's going to be interesting for you. It's going to teach you something. I'm just going to show it to you 3. It's only going to take 5 minutes. Are you keen? Are you interested? And the 3 of them are like, yeah, sure. So they come and they sit around the mat, and the teacher starts doing the presentation of whatever she's showing them, whether it's a maths concept or an English concept. It could even be something interesting and sparking curiosity, like some kind of science experiment, or interesting fact in geography. So think of anything that could be appropriate, relevant, and possibly interesting for these 3 kids. So my question would be, these 3 hypothetical kids, if you're watching them, if one is a typically developing child, there's nothing wrong with her attention system, what would she be looking like? What would she be saying? What are her behaviors in that lesson? What does concentration look and sound and feel like? Now consider another child sitting next to her, and she's got quite a bit of anxiety. She's got what looks like inattention. She struggles with being in the present moment, typically. She's worried about a lot of things, so that's where the anxiety links in as well. What does she look and sound like? What is she saying and doing in that 5-minute lesson? So there'll be a third component that we'll talk about in a moment, but let's look at those 2 kids. The one that is easily able to learn isn't sitting with any kind of anxiety or ADHD diagnosis. What she's looking like is pretty immersed in the lesson. She's not distracted by noises around her and movements around her. She can keep her focus on the teacher. Her auditory focus is very clearly sitting or residing on what the teacher is saying, and her brain is putting all the other noises into the background of her attention. Visually, she might notice some things moving around, but her visual attention is on the teacher and what her teacher's hands are doing and showing her and what she's seeing. So in the background of her visual system will be a curtain that might blow, or somebody walks into the class, but in the foreground of her visual attention is what the teacher is doing. She's probably leaning forward. Her posture and her body language are probably quite elevated. She's engaged. Her core muscles are engaged. She's possibly tilting her head, leaning maybe her dominant ear towards the teacher. She's processing what the teacher is saying. She's really able to take the information, link it into what she already knows, what's already sitting in her knowledge, and try to find where that sits and find a place for it. That's what the first kid who's paying attention, who finds paying attention easy to do. That's what she potentially is looking like. And not always the case, because sometimes, and I know with me, is if I engage my visual system more, then my auditory system is supported. So my eyes might really look around at what the teacher's doing more, or I might close my eyes if there's only verbal instruction coming, because I can't have the verbal distraction in order to hear better. So another kid's or another person's attention might look like closed eyes, head bowed, because you're trying to push that auditory attention towards the speaker. But it tends to be very grounded and very calm and very much in the present moment. Now let's think about the second kid I was describing. So she's quite an anxious kid. She struggles with being in the moment. She's worried a lot about other things. She's worried about dad at home, the dog, the dog that passed away, the cousin that's sick, what her brother's doing in the other classroom, when break is happening, will somebody ask her to have too much food? All of that stuff is not in the background of her attention. It has equal footing in her attention when it comes to learning the lesson. So now think about her visual and her auditory system. If her brain is paying attention to the future as much as it's paying attention to the present moment, then she can't be fully in the present moment. So this little kid tends to trip over things, tends to not be able to follow instructions, because all of those things happen in the present moment. So now she's in this lesson. What does she look like? Well, she might be moving her body backwards and forwards. There might be some physical rocking and regulating motion she's trying to do, sort of a stimming, fidgeting, probe feedback, vestibular movements. As I say, she might be rocking. She might be trying to put that deep pressure into her body by crossing her legs and sitting on her feet. She might be sitting on her hands in order to try and ground herself and bring herself to the present moment, because consciously she wants to be there. She's agreed to be there. She knows she wants to learn. She actually is pretty curious. But then this other sort of future brain has equal importance in her body, and she's trying to fight it. So visually, a curtain blows and she looks over to the curtain. Somebody walks behind her and she follows them around the class. Something on the desk rolls off the desk and her eyes follow and look at that. And she keeps being drawn to other visual things and away from the thing that she really wants to focus on and needs to focus on. The same thing will happen with her auditory system. There's a noise outside, and her brain goes to the noise, and then back to the teacher. Then somebody whispers behind her. Her brain goes to the whisper, then back to the teacher. Can you imagine how tiring that is? All she really needs to do and wants to do is pay attention to the teacher, but her brain is not isolating what's important. It's seeing everything as important. So the second girl that I'm describing now is going to look like she has attention deficit, and she's going to be really not learning as much as the first child at all. She's taking in maybe 10% of what the teacher is saying, whereas the first child is taking in approximately 80% of what the teacher is saying. When we say children pay attention or don't pay attention, it really, really impacts their learning. And the solution is not simple if we understand it in this context. So one of the first things we want to do when any child is struggling with attention is to address the anxiety that they have, to address how grounded and regulated they are. Then we start looking at their input systems, visual and auditory, tactile, even their gustatory and olfactory systems. How are they taking in information? Are they able to discriminate between what's important and what isn't?